Okay, let me explain to you what a granuloma is. That's what we're gonna explain next. So, it's a chronic inflammatory condition. Of the skin, of other tissues, right? But we are talking dermatopathology. That lasts for more than 6 months. So the duration here is more than 6 months. The defining characteristic of a granuloma is that a histiocyte are the predominant cell type present. While it is the main cell present, other inflammatory cells can also be involved, right? And we can state some of them like lymphocytes, like plasma cells, like basophils, eosinophils. Okay. So the characteristic cell present or inflammatory cell present in a granuloma is histiocytes. Are histiocytes. And other inflammatory cells can be present. And we can state some of them like lymphocytes, right, plasma cells, basophils, eosinophils, so first, before we know this, before we need to dive in the pathophysiology of a granuloma. So we need, right, an antigen first, right? So it's an antigen. We're also gonna explain how we got the histiocytes, which are the cells that actually gonna react here. Okay, so an antigen, it's usually insoluble, resistant to stimulation and digestion. So the body has difficulty breaking it down, leading to a prolonged inflammatory response. Of course, like certain bacteria, like TB, or any foreign materials, something like that. Histiocytes, in general, inflammatory cells, as we said, it's the main inflammatory cell are histiocytes. Other, as we said, can be found. Okay, histiocytes. What are histiocytes? Histiocytes started as pro-monocytes from the bone marrow, and then it circulated in the blood as monocytes, and it started formation, migrating into the tissues, and they become macrophages. And when they settle in the tissues, they are called histiocytes. So once they migrate, they are called macrophages, and when they settle, we can call them tissue macrophages or histiocytes. Histiocytes can gather up together and form multinucleated cells called giant cells. And these giant cells are a characteristic feature also of a granuloma. But we understand that these are just multiple histiocytes. So an antigen is insoluble, hard to digest, hard to break down, by the system, by our body. causing, okay, in between brackets we can write this down, causing a chronic inflammatory condition, chronic inflammation or chronic inflammatory condition or inflammatory reaction. Histiocytes start as in the bone marrow as promonocytes, circulate in the blood as monocytes. Right? Means just monocytes means cells with one nucleus. And when they migrate into the tissues, right, they start being called macrophages. Macrophages. And then when they settle down, they can be called tissue innate tissues. Right? It can be called tissue macrophages or histiocytes. And then multiple histiocytes, right? Multiple histiocytes gather up, forming a multinucleated cell called giant cells, right? Which is also characteristic of granuloma. So it's understandable why we just wrote here histiocytes. We can add also giant cells, which are also a group of histiocytes.